Hello, and welcome to The Beat, a news and talk program brought to you by the Center for Community Media at Worcester State University. I'm your host, Zachary Zupko, and today we'll be speaking with Dr. Michael Hirsh, Medical Director for the City of Worcester. Before we start here, let's start out with the introductory question. Can you explain a little bit about yourself and your background in the medical field?
Yeah, well, I guess the Reader's Digest version that I would give you is I graduated medical school 40 years ago. I kind of wandered into the medical profession mostly because of my mother's nursing background. She had been trained as a nurse in concentration camp, and when she came to the United States, she got me very involved with visiting her in her hospital that she worked in New York City. I'm a New York City kid. So I think I gravitated towards medicine that way. While I was in medical school, I got very enchanted with surgery, and later in my training in New York City in pediatric surgery. So I finished a ped surgery fellowship and began my medical career here in Worcester in 1986. So I've been here a while. I took a 10-year break to go to Pittsburgh, and during that time got very involved with injury prevention and trauma. And when I came back to Worcester, that's kind of what I've been concentrating on. And there's more of the backstory I can give you, but I don't want to take up the whole interview with that.
Oh, no, that's fine. It's an incredible story there you got there for yourself, so I applaud you for that. So, all right, let's move on here. So, what are some of the major public health concerns that affect the people in the Worcester area?
Well, there are certainly great concerns about access to medical care, about the overall mental health challenges that people are facing in our country, really, but in our community, we're no exception, about substance use disorder and all the ramifications of that. And I think the overarching thing that we've seen that exacerbates all of those problems is what we call health inequity. There's a clear demarcation between the community of color, the community of immigrants and refugees with our Caucasian citizenry. And if we could solve any one of those things, it would have to be through a lens of making sure that we're raising up all segments of our community.
Oh yeah, it's understandable, perfectly reasonable there. So let's move on here. What are some reliable sources of information for parents to find answers for their medical-related questions?
I think if parents are concerned about almost any medical issue, hopefully the most usable source of information would be their own primary care physician, whether it's a family medicine practitioner or a pediatrician. But there are some really good websites online. That in and of itself assumes that the parent has access to a computer, and that in and of itself carries, again, the inequity piece. There are websites like WebMD, UpToDate, and there are many like that where you could look up information. Unfortunately, unfiltered and without the advice of a physician, I think it's dangerous to assume that everything you read on the net is going to be as accurate, because it doesn't take into account your particular child's other medical conditions and the knowledge that hopefully your primary care doc has about your family and your situation.
No, yeah, that's true. You can't take everything for granted on the internet these days.
Right.
So, and move on to that here. Recently, there have been many people that are opposed to vaccinating their children. Do you think there is cause for concern for measles or other diseases to spread here in Worcester County that could have been prevented by vaccinations?
The anti-vaccine movement has a lot of different source material that they're unfortunately calling upon. On the side of vaccinations for things like polio and the flu and things that we kind of don't assume would carry a lot of risk with them, there was unfortunately some erroneous literature put in the British medical literature that had an association between vaccination and autism. And a few celebrities in Hollywood latched onto that and made that part of their crusade. So that's part of the anti-vaccine movement. And the other part is that unfortunately some fairly fundamentalist religious groups in the Orthodox Jewish community and in the Orthodox Muslim community have come to believe that somehow the material in the vaccines are not compatible with their religious beliefs, so they have been avoiding vaccination. When that population now has been traveling back and forth to Israel and other parts of the Middle East, they've been exposing themselves to measles and bringing it back. So that's why there's such a pocket of outbreaks in Crown Heights in Brooklyn, New York, and Rockland County, and just north of New York City. And we're, I think, not as liable to get an outbreak like that here, but some of those communities have children that are going to our universities and our religious schools, and I think it could happen here.
Oh yeah, and we all don't want that to happen any day in particular.
Right. I mean, the concept, Zach, of herd immunity, you know, not to make it sound like people are cows, but that's really important. And if you don't have a vaccinated community with greater than 90% of the community being vaccinated, you're at risk for these outbreaks. Now, you know, people sometimes will poo-poo, oh, he got measles, so what? Who cares? Measles kill about 1,000 kids a year in Europe. And in the days before we almost completely eradicated measles in the United States, which was officially sometime in like 1978, we declared measles eradicated because of the vaccination. We would have a similar number in the United States, somewhere between 500 and 1,000 kids would die. And it's totally preventable, totally preventable. So there's no excuse for not vaccinating.
Indeed, agreeable right there. So, can you discuss what the city of Worcester is doing in response to the opioid crisis, or the resources available to the residents if they need help for themselves or someone in their life?
Well, complex question. We kind of started with a very basic premise that we didn't want anyone who overdosed to die, and worked backwards from there. We haven't done well on the root cause issue in terms of why are people turning to opioids and heroin and fentanyl because of some underlying malaise or sense of hurt or pain that they're feeling. We're not addressing that. It's almost too big for our pay grade at the Department of Public Health. What we have done, though, is widely spread the ability of first responders or family members with kids with known substance use disorder to administer the medication called Narcan. If you're familiar with Narcan.
Yeah, I've heard of it before.
It's now available in a nasal spray form. It's very easy to administer. And we've been urging, and with public health campaigns, information campaigns, people with loved ones with these known problems to have them handy in the house. And we also have trained all of the paramedics, all of the police officers and the firemen who are first responders to have this, so that when they come upon an overdosed victim, they can administer this, and it's an overdose, yes, but it's not a fatal overdose. And we really cut down on the number of fatal overdoses. We haven't cut down overall on the number of overdoses, and that is a bigger nut to crack.
Yes, indeed. There is a growing awareness of the importance of mental health, and many people are working to remove the stigma associated with mental illness. From a medical perspective, what can we do to be more aware of mental illness and how it affects people?
Well, that's a great question, and that's what I was kind of alluding to before. I think a lot of where the substance use problem comes from is the untreated mental health issues that are out there. And many primary care physicians and emergency departments don't really feel adequately trained or prepared to deal with mental health as another aspect of overall health. They like to compartmentalize it and say, oh, that should be taken care of by a psychiatrist or psychologist. We're trying to encourage primary care docs to really look at mental health as another organ system, just like if you would look at somebody that had arthritis in the knee or diabetes, you would make a list of all these different areas where your patient might have a problem. If they have depression, if they have obsessive compulsive disorder, if they're bipolar, all of those things should just be counted as another aspect of their health profile. And we want them to get treated. Obviously, a primary care doc doesn't have as many skills as a mental health professional, but we want them at least to get mental health first aid in the primary care setting, so that you don't just blow the people off and say, we'll get you a psychiatry appointment. The psychiatry appointment can be 4 months down the line. And with the rising toll of suicidality in the community, suicide is really going up, not just in Worcester, but all over the country. We really can't put those things off. And part of the problem is that people feel the stigma of being labeled as different with their mental health issues. And docs, again, I think have up until now not been getting adequately trained in that basic mental health first aid. That's changing on the medical school side, I can tell you from how we train our UMass medical students. And I think it's changing on the public health information side. We're really trying to get the word out that these are our fellow creatures of pain, whether it's pain from a broken ankle or pain from mental illness.
Yeah, and I think it's very important that we treat each other like decent human beings. One of your areas of expertise is injury prevention. Can you briefly discuss the importance of this topic for our viewers?
Well, I think this is the low-hanging fruit of injury care in the United States. We have a problem in the United States in that from the age of 0 to 34, injury is the #1 killer of people. And it's also the least funded area of care for people. There's much more money for cancer, for HIV, for different kinds of infectious diseases, even for some pretty rare neurologic conditions, than there is for trauma care. For every dollar that you spend on injury prevention, you save about $70 in medical care.
Wow.
And that medical economics thing is clear from the data, but what's not clear is, since we're in this system where doctors get paid for what they do, prevention doesn't get any reimbursement. So it's very hard to get docs to take time to give this advice. Not pediatricians, though. I would say pediatricians and family docs who take care of children realize how important this is. And as I said, it's the 3 most important injury prevention questions you can ask a parent when they have a little child come into the doctor's office are, do you have a working smoke alarm? Do you use some kind of child restraint device if you're in a car? And do you have a gun in the home? And you very rarely see an adult primary care doc ask any injury prevention questions. There are mandatory questions the government demands that you to ask, like, do you feel safe in your home? And for women, do you ever feel like you're at risk for spousal or intimate partner abuse? But that's about as far as it goes. And it's got to go farther, because injury prevention, I think, is, as I said, the easiest way we could save a lot of dollars in the system, which is already bankrupt.
No, yeah, definitely for sure. Let's move on here. Do you believe in any alternative forms of medicine? And if so, which alternative treatments do you believe are the most beneficial to patients?
I can't really say that I have scientific data that I believe in them all, but I have anecdotal data in the care of my patients and also in my own personal care that I believe that things like yoga, meditation, and acupuncture all have their place in the care of patients. I had an acupuncturist work on me for residual pain from a knee operation I had last year. And I honestly, whether it was in my head or not, I really felt the most relief from that, more than any of the physical therapy that I had and some of the other things I was trying to do to rehabilitate myself. So I think these techniques are important, and we're finding more and more of our incoming medical students and medical professionals, like at the schools in Worcester that are offering these kind of PA and NP education. They're interested in and want to learn about it, which I think is great.
No, yeah, it's true right there. So before we move on to our last, let's move on to our last question here. What do you think about social media users on sites such as Facebook and YouTube that contribute to the public's perception of various medical issues?
That's a very involved question, in that, like so many tools out there, it can be used for the good or it can be used for evil. And when you go back to your vaccine question, I think, unfortunately, the anti-vaccination group has been very savvy in how they have used social media to scare people about vaccines. On the other hand, we've been able to get a lot of advance word out about healthcare initiatives, about our own community health improvement plan here in Worcester, which is a roadmap for Worcester and the 6 surrounding towns that have joined in Central Mass Regional Public Health Alliance to move public health forward. And without that kind of involvement of the community electronically, we would have much less participation than if we were just counting on focus groups or town hall meetings or other kind of public events. So I think it's a tool. It's only as useful or as helpful as the people programming it. And unfortunately, I don't think we can filter out the bad uses of it, because who's to say what's good and what's bad, and then you're into the whole First Amendment thing. So I think we would encourage the folks that are really savvy in it to figure out that their responsibility is to align in a way that helps the community and doesn't scare the community.
Oh yeah, and that's where we have to find that balance within social media. You have to filter out both like the good perspectives and the bad perspectives towards medical related issues, not within like the community, but also in the state and towards the United States as well. So
yes.
I think it's important to keep that in mind.
Absolutely.
So thank you for coming on here for today. Thank you for watching this segment of The Beat. Please remember to like our Facebook page and follow us on Twitter. We'll see you next time.